Hello, everyone. Thank you for joining us for the ACRL Health Sciences Interest Group Friday Forums. So today we are welcoming Bryn Campbell-Rice from NYU. Thank you for joining us, and thank you for presenting today on the topic of balancing acts, personal health narratives, and scientific evidence in the age of misinformation. So Bryn, at this point, I will hand it over to you.
Great. Thanks, Jules. So I am a librarian from NYU, specifically the liaison to our College of Nursing. So as we get started, I thought it might be helpful to give a little bit of context about kind of who I am, why I'm here talking about this today. So I do support the research and information literacy needs of nursing students and nursing faculty. So a lot of that is around finding evidence for evidence-based practice and evidence synthesis. So a lot of instruction, a lot of consultation, talking about information literacy for future healthcare professionals, which dovetails with my research interests, where I spend kind of more of my time thinking and reading around health information literacy more broadly, particularly online health misinformation, embodied information, and people's beliefs about knowledge, so epistemic beliefs. So I'm here because I'm still fairly early in my career as a librarian, but as I get further along, kind of operating in the paradigms of evidence-based practice, evidence synthesis, and pursuing my own research interests, there are some tensions and some contradictions I've started noticing and I've been grappling with. So I thought to propose this session as a space to kind of highlight and describe some of those tensions, um, solicit some perspectives from other librarians who are interested in health, interested in misinformation, health narratives, and hopefully begin to discuss some productive paths forward. So I'm coming from this kind of from the perspective of somebody who's working in a very applied field with nurses, but also thinking about how we cultivate lifelong information literacy practices for people who will become healthcare professionals. And I think a lot of these ideas extend to how we as librarians talk about and teach about source evaluation for health information more generally. So I'm going to start by kind of establishing where I'm seeing these tensions crop up, thinking about how personal health narratives can act as carriers for health misinformation, but also health information coming out of personal narratives being really powerful. And so why it might be harmful to teach students to be dismissive of health narratives as anecdotal or weak evidence. So with that tension, I'll try to offer some approaches and strategies that I'm starting to explore as far as how to navigate that, with some time for discussion. So please feel free to pop questions in the chat. Jules is keeping an eye on the chat for me. And then we have time built in at the end for some more open discussion. So before I jump in and start about talking about misinformation, I kind of want to establish the genre that I'm thinking about, particularly around health narratives. So kind of self-explanatory, but these are stories usually told from the first person where a person is linking kind of their personal health knowledge to a wider story of their life, their experience, kind of the context for their health. So I see these happening especially online, on social media, but not necessarily exclusively. Like anyone can tell you a story about their life and their health within their life. But this is sort of the genre that I'm thinking about when I'm thinking about how narratives might be a vector for misinformation. So whenever we're talking about misinformation, I think it's important to define what we're talking about because it's not necessarily always well defined and can be kind of tricky to define. So the definition that I work within is misinformation being false or misleading information about human health, where facticity is judged against the current best available scientific evidence and or consensus from health experts. I think it's important to include misleadingness in order to acknowledge that misinformation is often more complex than simply true or false. Something can be technically true, but also misleading. And I also think it's important to include a reference against which a fact can be judged. This piece actually can get really sticky, and there's a lot of interesting discussion in the misinformation literature about like what counts as expertise, what counts as consensus, what are the limits of scientific evidence. But as I'm trying to stay grounded in kind of the body as sort of a material physical system, um, I do believe that scientific and medical inquiry gives us really powerful tools to understand that system. So having a definition that puts us in reference to scientific evidence is helpful for me as I'm forming my thoughts. If you want to kind of explore that realm of the literature, sort of the trickiness of defining misinformation, I've got links in the notes. I'll share my slides to some references throughout. So when it comes to misinformation, sort of what inspires me and what kind of keeps me interested in this work is the fact that misinformation has real material harms on people's bodies. So in as far as people make decisions based on false or misleading or incomplete information, there is a real, physical effect of this kind of information. So we see this happening right now with vaccine misinformation, declining vaccination rates, and measles. I see this when I think about kind of the supplement industry. So misinformation kind of being the currency of the supplement industry, which is unregulated, distributing questionable substances into millions of people's bodies. And then one example that's probably the closest to my heart is related to kind of misinformation around cancer cures, where people may delay or refuse treatments that could actually extend their lives. So even though a lot of this work is kind of idea work, I think it's really important to keep the human body at the center of it, and understand that this kind of information does ultimately become embodied, which is what makes it interesting to study for me, and I think why it's important to understand how it can be so persuasive and have an impact on people's health behaviors. So there has been quite a bit of research about what makes online misinformation persuasive, so much so that there was a systematic review done a couple years ago that found 58 studies, all mapping kind of the reporting on the persuasive elements that are found in online misinformation. And one thing that their review kind of confirmed, which a lot of us who work in this space probably suspected or perceived, was that the use of narratives and personal experiences is a really common element found in online health misinformation. So that's kind of what I want to focus on first is what is it about a personal health narrative that makes it so persuasive? And I'll talk about sort of three elements that I think are particularly relevant when we're thinking about misinformation. So first thinking about kind of the personal nature of these kinds of stories, um, there's often an emotional resonance that happens when somebody is sharing an experience that's very intimate and deeply connected to sort of their lived experience. So stories that evoke kind of fear or hope can really bypass your sort of rational defenses as far as being critical of the information that's shared to you. There's also kind of a cognitive bias at play. When we're hearing people's stories, we're inclined to believe them. Humans are social creatures. This is kind of a fundamental aspect of human communication. If you hear a story that's told with conviction in a convincing way, it's very easy to believe a person's kind of health narrative. But because it's so kind of subjective and deeply personal, it can be difficult to be critical of that. Can you really like fact check or interrogate what somebody is describing as a personal experience or something that is very much held within their own body? So that's one element of these kinds of stories that I think make them challenging from a misinformation perspective and also persuasive. The other piece is kind of the story element of it. So when somebody is telling you a story that's structured in a really clear kind of narrative arc, that's really easy to process and kind of put together a vision for truth or a vision for how their story might make sense. Ease of processing is kind of a cognitive heuristic that we often use for truth. And so it's easy to read something like causality or correlation from a story that somebody is telling you. Even if they don't say, a vaccine caused my child to have autism, they might tell a story in a way that really paints that causal picture. Storytelling also, because it's in these cases very much first person narrator, a person can be selective in what information they're choosing to share. So they can choose particular aspects to share while ignoring other kinds of evidence, which can create a really compelling story that kind of moves you in a specific direction. And then the last piece that I thought was really interesting as far as narrative effects, especially around social media, there's some research about this idea of blurring. With humans being kind of social creatures and making connections and meaning through storytelling, when we hear a story, the distinction between a single person's story and kind of a collective experience is really, really easy to blur. There's an interesting reference I have linked in the slides about when stories get told on social media, experiential narratives are likely to be received and interpreted as kind of broader cultural scenarios. So it is easy from a cognitive perspective to take a person's story and begin to paint a picture that seems like you have knowledge of a greater phenomenon, even if it is just one person's story. And then the last element of the persuasiveness, I think, comes down to some of the complexity of these kinds of stories. So misinformation is rarely just true or false. There's usually a little bit more of a spectrum at play. So real facts might be involved. They might be presented out of context or selectively highlighted in a way that makes it kind of difficult to understand what's true and what's false here. Some of the research around misinformation and kind of the virality of misinformation shows that this sort of partially true kind of misinformation is really difficult for people to parse. When it's not so black and white, it's just that's a true thing, that's a false thing. There is some research that says when there's a grain of truth around what is being said, it's a lot easier for that kind of information to spread. So I would argue that people's kind of real, honest health experiences can serve as the grain of truth around which misinformation gets wrapped, which then makes it spread much more easily. So with all of this stuff in mind, if you're aware of the conversations happening around health misinformation, none of this is probably news to you. So if you're like me and you're really interested in cultivating health information evaluation skills or information hygiene, this kind of leads you to the conclusion that should we be teaching students to be suspicious or skeptical of personal anecdotes or unverifiable narratives? Um, I kind of want to problematize that a little bit by suggesting that it's actually important to take other people's stories seriously, especially when they're talking about their own health. So in the next part, I want to argue that being dismissive or super critical of this kind of information is problematic and actually kind of contributes to overall belief in misinformation. So I want to highlight that this kind of storytelling, people talking about their health, is actually really important as a health information source, especially for people who are going to become health professionals to be able to hear and take seriously as a form of knowledge. So personal health narratives add a lot of context and meaning to kind of our collective understanding of health and of illness. Those sort of rich details that you get from hearing somebody's stories really keep the human being at the center of the conversation about health. These kinds of stories can also fill in some of the gaps in knowledge. For under-researched or rare conditions, sometimes most of the evidence that we have about something is coming from people telling their stories or talking about their experiences with symptoms or with finding treatment. These are also really important for kind of cultivating peer communities around specific health issues. So people gain a lot on kind of a psychosocial level by being in community with people who are going through similar experiences, and storytelling is a really important part of that. So a lot of knowledge sharing takes place in peer communities online where they're talking about health things or sharing health stories. So I don't think that saying all online health information or all online narratives should be ignored as the answer here. And then lastly, there's a decent body of evidence in the narrative medicine world that suggests for healthcare providers or people who are going to become healthcare providers, hearing patients' experiences is a really important way of building empathy and kind of cultivating a patient-centered ethic of care. So not only are they really important to take seriously, these kinds of stories, um, this kind of dovetails with the research that's beginning to happen around epistemic justice, which I think more of us in libraries are also starting to hear about. So I want to talk about that a little bit as well. Um, if you're not familiar with the idea of epistemic injustice, it's pretty simply a wrong that is done to somebody specifically in their capacity as a knower. So this originates with Miranda Fricker, and she kind of describes two forms of epistemic injustice, hermeneutical injustice and testimonial injustice. I think they're both kind of connected to this conversation in different ways, but particularly testimonial injustice, where a person who's kind of hearing or receiving information has some kind of prejudice or bias that causes them to disbelieve or not assign the appropriate credibility to what they're hearing. And this has pretty serious implications when we're talking about trust in science and trust in medicine, and belief in misinformation among people who are likely to experience the effects of that kind of bias. So we can talk about like medical gaslighting. If you're not familiar with that term, it's essentially the phenomenon of specifically healthcare professionals, whether intentionally or unintentionally, dismissing or invalidating or minimizing a person's symptoms, attributing them to psychological factors or kind of minimizing them. This is a form of testimonial injustice or an example of. And there is a real kind of psychological and ethical harm of having your account of your own body, of your own life being disbelieved or dismissed. Um, this has been implicated in kind of developing mistrust in healthcare and medicine, which has pretty serious implications for access to care among people who are already marginalized. Um, there is also kind of an interesting connection here where distrust in medicine is associated with an increased susceptibility to health misinformation. There's an article, I'll mention the citation on the next slide, that sort of suggests that the experience of testimonial injustice leads to kind of a justified belief in misinformation. Um, this is an article that comes out of the philosophy literature, so bioethics, and the author essentially argues that when a person has experienced testimonial injustice, they're rationally justified in believing in alternatives that better correlate with their own lived experience. So essentially, if you're experiencing a symptom, that gives you strong evidence about something that's happening to your body, to your life. So when that evidence is dismissed, that undermines the credibility of sort of the system or the person or the relationship that's dismissing it, which this author argues kind of leads into health-related conspiracy theories, which are kind of a specific form of misinformation. But I thought this article is a really fascinating kind of convergence of some of the things we talk about how do we encourage criticality in information, but we also need to take people's experiences seriously, which is sort of the tension that I'm kind of wrestling with. Um, Knowing that health misinformation has real harmful effects, personal health narratives are implicated in the spread of that kind of misinformation, but it is harmful and ethically problematic to not take people's testimonials seriously as a source of knowledge, particularly if you're in a position of becoming a healthcare provider. So that leads me to try to find some kind of balance, kind of reflecting on the work that I'm doing about information evaluation and evidence-based practice and misinformation. How do I sort of try to integrate or find a middle path or sort of work within these tensions? So one strategy or approach that I find myself falling back on a little bit is trying to delineate the different forms of knowledge and sort of keep them separate, keep personal health narratives in sort of their appropriate epistemic context. So being part of or part of being a health librarian is teaching students how to operate in the frameworks of health research. So we might think a person's story is true, but it doesn't give us sufficient evidence about something like treatment efficacy. For that, we need quantitative evidence. For that, we need randomized control trials. So really falling back on kind of the norms of evidence within a discipline and keeping it bounded in that way. I have the evidence pyramid up here, which many of you are probably familiar with. Thinking about in this context, a single person story might not be particularly powerful because it's not necessarily an authoritative source on this topic if we're working within this pyramid. It's possible, I think, to say a person's story is true and meaningful, but it's not appropriate to use if we're working within kind of this discipline. And this is typically where I find myself now, working with nursing and working in kind of an evidence-based practice mindset. Personal experience does provide some evidence, but it's relatively low on an evidence hierarchy. Uh, for me, the pro of this is it's simple. It keeps things very bounded, and it is more comfortable as far as staying in my lane as a health librarian. So I can help find the best available research evidence, but there's this whole other sphere of evidence-based practice where you as the provider have to be attentive to patient preferences and values. This, I guess, is kind of helpful, but to me feels a little bit insufficient just as a way of thinking about this problem. If we're trying to prepare students for sort of a whole life of information literacy, just staying in our lane is a little uncomfortable in some ways. So that's led me to start to think about how might we approach source evaluation with kind of a triangulation mindset. This is kind of philosophically aligned with SIFT or lateral reading, if you know what I'm talking about. If you know misinformation studies, you probably know SIFT. But kind of taking a cue from the principles of evidence synthesis, right? Bringing together different forms of evidence in a way where we can acknowledge the validity of personal health narratives as a form of information, but also encourage a criticality that invites students to put these in conversation with other forms of knowledge. So thinking about instead of putting things on a hierarchy or levels of evidence, looking for the way that different forms of evidence confirm or complement or diverge or sort of paint a broader picture of a particular health phenomenon. I think that this is potentially an interesting approach. It's less about kind of ranking. It gives diverse forms of evidence, can be more equal footing, so it's a little more holistic in that way. I also think it's much more difficult. It's not something that I've started to try to integrate into my work yet, because I think it does require a lot more nuance and a lot more contact over the course of the curriculum to begin to develop these kinds of literacies and behaviors. The thing I like about trying to think about source evaluation in this way is that it's better aligned to kind of the everyday information literacies and information behaviors that I think extend beyond people's or students' just kind of academic or professional spheres to cut across sort of what does it mean to be an information literate person in the world. So there is beginning to be a little bit of a body of literature on everyday information triangulation as sort of a way of describing information practices outside of an academic context. There was this really interesting dissertation that came out last year about how people make decisions and seek information about using cannabis during pregnancy or lactation. So this was a nice kind of health example of how we might think about understanding the way that information gets integrated in kind of an everyday decision that somebody might have to make. What I'm interested in as a librarian is how can we encourage our students to be kind of have a triangulation mindset and be thoughtful about the kinds of sources they're seeking. So before I open it up for discussion, just to sort of summarize where I am, given sort of the real material effects of health misinformation, as a health librarian, I do feel a certain responsibility for helping students develop information literacy skills, but I don't want to encourage them to be so skeptical or dismissive of personal health stories that they kind of miss the value in those stories. So I'm thinking about how to try to balance these, and I'm still working on how to integrate that into my consultation and instruction work, which is what I'm hoping that we can talk about. So my thoughts for discussion, I'm curious if other people are perceiving these tensions in what they're working on, and what strategies do you think are available to sort of support users in evaluating a personal health story in a critical way without dismissing the value of that lived experience, and how we can talk about or teach about that kind of information in the context of evaluating misinformation.
Okay, if we are moving on into the discussion portion, I can go ahead and stop the recording since we want the forum to be open for people to speak freely. So I'm going to go ahead and stop the recording now. Thank you.
Thanks, Jules.